Welcome to A Shot in the Arm podcast. I'm your host, Ben Plumley, and this is a podcast about innovation and equity in global health. Today's episode sees a return to a theme that we began at the start of the year with Eyal Zimlichman from the HIPAA Medical Center in Tel Aviv, about how innovation in itself is not enough. It is about how it is employed to transform the healthcare experience of people that matters. And today, we are going to meet a young entrepreneur from the US who is doing just that. But before we get into it, a few subscribers have asked why, given all the disruption in global health, in research and development in medical science, why are we spending so much time on HIV? Isn't there much more to talk about? Well, indeed there is, and we will cover it. But HIV is the canary in the coal mine. It was one of the first of a new wave of global zoonotic infections that hit the world in the 21st century. It's a reminder that epidemics are not just medical crises, they touch on every aspect of our lives, and they thrive in communities that broader society chooses to ignore or persecute. It's a reminder how fragile our progress is, and how we can't afford issue fatigue, that we can't afford to swipe down to the next 30-second clip, and it's a reminder of how interconnected we all are. So that's why we're keeping a close eye on how the global HIV response is being affected by this sudden disruption in global funding. But it's also at the forefront of innovation, through necessity and also through opportunity, and that brings us back to today's guest. Well, I'm thrilled to welcome Mackenzie Copley, the co-founder and CEO of Shine.io, to the podcast to inject some hope and optimism into what is possible in HIV and beyond. Mackenzie, welcome to A Shot in the Arm. How are you doing?
Thank you so much, Ben. I'm doing well. I appreciate you having me.
So, tell us a bit about yourself first up. I was introduced to you a while ago by a friend of the pod, Sean Howell, one of the founders of the Hornet app, and I followed your career very closely. But tell us, how did you get into all of this?
Yeah, totally. And it's great to be on here, and it was great meeting you a while ago, and you've done an amazing thing with this podcast, and it's really cool to be on the platform and get to talk to you about what we're up to now. So let's see. So where we're at now is a function of where we've been. So, of course, I'll give you the skinny. I grew up in Massachusetts. I came down to Washington, D.C., where I live now, about 13 years ago to go to school. When I was a senior in college, I've always had like a really strong sense about helping people. Just feels like the right thing to do. And if there are problems and you feel like you can solve them, I think I ought to. It takes a big team, and it's just, I'm really grateful to get to work on problems. And so I originally I got into HIV when I was 21, about 11 years ago. I went and got my first test, was feeling super nervous, and like worried and guilty and just concerned. And while I was there, I asked the nurse if I could volunteer for them, because I thought, I'm sure I'm not the only one who's worried about this. Maybe I can do something. I've always just been really action oriented. And so she kind of looked at me funny with the needle in my arm, and she said, sure. And so a week later, I was out doing HIV testing in the community in Northeast DC. But the problem that I saw is that they had people waiting in line for a long time, and then getting up to the front, and when they said that they didn't have insurance, the clinic would turn them away. And now, years later, I appreciate, or I understand where the economics around it, and how you need to make sure programs are sustainable, things like that. But maybe a big benefit of being 21 at the time and being a bit more naive about that was it really just felt like a moral issue, like black and white. If someone doesn't have insurance, they're at greater risk. We need to test them. And so I asked the owners if we could test them. They said no. And so at 21, I said, well, screw you guys. I'm going to go start a nonprofit and test everyone. And so a few days later, I went to Starbucks and Googled nonprofit bylaw template and literally downloaded a Word file and began. And so since then, we launched the organization called One Tent Health, which was a nonprofit. designed to do canvas tent-based testing in front of grocery stores, laundromats, in like the lower income neighborhoods of Washington, D.C. And after a few years, we launched it. I quit my consulting job to dive in full time. And since that time, we tested 15,000 people for HIV as well as COVID. We had a great team of 1,000 undergraduate volunteers. We identified new cases of HIV 4 times more often than the city's average, and published that research with a team at Harvard, and got to present it at the CDC actually. And as a result of all that work, they appointed me to President Biden's Advisory Council on HIV and AIDS, PACHA, in 2023.
I wanted to ask you about that because the President Advisory Council on HIV and AIDS, that no longer exists, right?
Not technically. So technically it does exist. We're curious. It feels like we're definitely on the chopping block. Just like public health is crazy right now. I don't need to tell you. But even though the OIDP staff has been riffed, PACHA technically is still like in existence. And so we actually got to write a letter to the secretary the other day and make sure that we're still taking steps and actions on behalf of the people to make sure that HIV services get provided as best as possible.
So you are still then technically on President Trump's Advisory Council on HIV and AIDS. Well, good on you.
Sounds great when you say it like that.
Yeah, right. So look, tell us about Shine. Why did you create it? It's a startup. It's a company. You've moved from the nonprofit environment. Why go commercial?
Yeah, exactly. In short, a few years ago, I was working on the city's 90-90-90-50 plan. I've been on the Limelight Planning Commission here in DC for about 10 years, honestly.
Hey, Mackenzie, let me stop you and ask you. You mentioned the 1995 plan. For viewers and listeners who won't know what that is, can you just explain what that relates to?
Totally. And sometimes it's, depending on jurisdiction, sometimes it's referred to as the 95-95-95-50 plan, different things like that. But the general idea is that years ago, as a result of U equals U, cities put together plans to reduce the spread of HIV, is how they termed it at the time. And the whole point is to reduce the number of new cases each year by 50%. And the way that you do that logistically, what they determined and figured out, is that you can do this care continuum cascade down where you get 90% of people, you identify 90% of the cases of HIV, you get 90% of those people in care, seeing their doctors, and then 90% of those people to be virally suppressed, aka taking their medicine. And if you do all that, it should lead to a 50% reduction in the new cases of HIV, which is amazing because HIV, like the virus, is the enemy. And
right.
we want to like minimize it as much as possible. We want to keep the people who have it alive and well, and also like minimize new infections. And so
and within our grasp is the ability, if we put our mind to it, to end HIV or end AIDS as a public health crisis.
Yeah, exactly.
But in practical terms, we've got a long, long way to go. But anyway, back to Shine.
Exactly. We have big steps to take. But so I was thinking all about that, and like, because I was on the Ryan-White Planning Commission and wanted to solve it. And so I was thinking about it, and it was one of those moments where I had all the facts, but I just hadn't lined them up in a certain way. And it led to like quite like an aha moment. Basically, seeing that cascade down to like reduce the new case of HIV, and it all is possible because of U equals U. Undetectable equals untransmittable. If you're taking your meds regularly and they're working, then you should get a suppressed viral load. At that point, you have essentially a clean bill of health. And also, you're physically unable the virus is physically untransmittable, which is incredible. And so there's this moment of realization when it's like, well, if that's true for one person, we get them to take their meds, we help them take their meds, we like zero the possibility of the virus spreading. Well, what would happen if we got everyone to take their meds? And the answer is we would end the HIV epidemic. I was like, holy crap. That is freaking amazing, you know? And so then that just got me thrilled, and I was like, oh my gosh, well, we have the tools to do this. Now, how do we how do we like help people take their meds? Like, how do we like minimize barriers to access and just increase like the priority, because life's busy for people, and there are a lot of reasons why people don't take meds, but a lot of them are like the social determinants of health, where it's hard to prioritize your long-term health. And so anyways, that led to this like realization and thought process of, well, because I always think about incentives, and this is how Shine was born. I always think about incentives because I studied economics and physics in school, econ for business and physics for pleasure. But so I was like, well, what can we give people to get people to take their meds? Because the tool exists. Like, what can we give them? And my first thought was love. And I waited 3 minutes and I didn't have a product solution for it. So I was like, okay, cool, good starting point. But what could like get it done? And then my next thought was financial rewards, money. It's like man's greatest tool for survival. There's so much research about conditional cash transfers, and now that it's been a few years, or pretty immediately, we realized that there was like direct evidence and like studies that have already like proven that if you like offer people a financial reward to become virally suppressed, to take their meds and become virally suppressed, undetectable and untransmittable, they will do it. And it makes so much sense because it helps prioritize, like moves like a long-term cost of not taking your meds and like puts a present value on that action, and just helps you prioritize in a busy world, busy day. And so now it's been a while. We've taken a ton of steps. We've figured out so many different aspects of it, and we're actually getting ready to launch our pilot in Las Vegas, Nevada pretty soon. And the point is to reward people around $1,000 every 6 months when they upload their undetectable labs, prove that they're undetectable and untransmittable, and then we'll Venmo them $1,000.
So this is driven by an app, is it? And it encourages people who are on HIV treatment to make sure they get their 6-monthly viral load test to measure how much HIV there is in their bloodstream. And hopefully that is, as you rightly said earlier, undetectable.
Yes.
Big question that comes to mind then is, where does this $1,000 come from? Who provides that?
Yeah, it's a great question because you have to make it sustainable, right? It's like one thing to want to just give people money. And we know it'll work because there have been CDC best evidence practices that actually showed when you give someone $2,100 a year, they saw an 85% increase in viral suppression and a 55% increase in self-attested adherence, which is incredible. But so you want to make it sustainable because those same studies also show that when you remove the reward, adherence goes way back down. And it makes sense because something that like doesn't hurt today and won't kill you tomorrow, like it's just going to go down your list. And so the goal is to find like the most sustainable funders, if you will, or like sources of money. And so
investors, as it were.
Yeah, investors, but also like, partners. And so we envision those being like groups that have their like incentives aligned. So it's like thinking about perhaps the NIH, looking at pharmaceutical companies, looking at perhaps foundations that are mission aligned as well, but making sure that money comes from a source that is reliable. And we worry about NIH funding now, like with all the cuts, of course, right? So I think the pharmaceutical industry is the best option for it because they really want to see adherence increase as well. And if you want to make sure that a program is secure and sustainable, that's a great way to ensure it.
Now, of course, this all makes sense if you are taking daily HIV oral medications, if you're sort of popping your pill, a 3-in-1 medication taken once a day.
Right.
And we've got great evidence from all over the world about how effective that is.
Right.
But the field, of course, is moving and moving to long-acting injectables
LAIs.
that could be every 3 months or every 6 months. How does the app, the incentive to get your viral load done every 6 months, how does that fit into this new paradigm of HIV treatment?
Yeah, really well is the short answer. We're still going to see adherence issues with LAIs, like the tech and the medicines improve so much. It's like shots every 3 months or 6 months, but that still means that you need to show up for your next shot. And so, especially with HIV medication, you know better than most, like if you're not staying on your treatment, you can gain resistance. And so there's just a lot of reasons why you want to minimize that gap between shots and have that window be as tight as possible. And so we'll tie a lot of this behavioral economics that we just try to make as fair as possible, and align with the best health outcomes. That's the whole point. We just want to help people as much as we can. And so making sure that we tie that reward to getting your next shot at a time where it's medically optimal, to minimize resistance is the move and our plan. And so I think there's still a lot of value that we can provide in a long-acting injectable world.
So it strikes me that this works particularly well with people who have health insurance, particularly active young people who've got busy lives. This is a way of having a calendar reminder, and the incentive absolutely helps there. Given the mode of transmission and the populations that we're seeing, particularly in the United States, that perhaps are less able to access healthcare through insurance-based services, how does Shine accommodate them? What's the strategy for reaching out to perhaps lower income folks that are on treatment?
Yeah, it's a super great question about eligibility, and then also how are we optimizing equity around this and making sure that we're providing a solution that fits people's lives in situations no matter where they are. There's the initial rollout phase, and then there's the medium and longer term. The initial rollout phase will be quite confined by the rules and regulations and laws that exist right now. And so one of the big things that we've done over the last few years is dug into the regulations with our law firm, Morrison Forster. And what they've found is that we can do this. We can offer this to people, offer Shine initially to people with commercial insurance, as well as people who are uninsured. But we cannot offer it to people who are publicly insured, so are on Medicaid, Medicare, or on Ryan White, which sucks, frankly. And I'm not happy about it, but it's what the laws are. And so our plan to make sure that we can apply this to the people who need it most, those people who are publicly insured, is to gather good data from the pilot and the rollout with people who we can apply it to, people with commercial insurance. And we have a team of researchers at Harvard Medical School, and we're planning to publish both on the health benefits, but also the financial benefits individually, and then also if scaled, what would be the benefits nationally to reduce financial spending, reduce medical spending on those programs, because we know that every case that we keep from occurring is $500,000 saved by the U.S. government. And so once we gather that data and publish it, the plan is to go and present it to the U.S. government. And because we know which doors to knock on. One of the benefits of my being in Pacha is I've got to know a bunch of people who can help us navigate, to know where we can apply for the exception, and then get to apply it, give Shine to people with commercial insurance as soon as possible.
And this is because if you are on public insurance models, you can't accept financial incentives. Is that the base of the problem?
Yeah, that's the base of the problem. Yeah, exactly. There are nitty-gritty details that I could bore everyone with, anti-kickback statutes and things like that. But yeah, that's the basis. And then one of the things that we're really trying to be cognizant of when we do get to expand to people on Medicaid, Medicare, Ryan White, is to make sure that the payment, or the rewards rather, are given in a way that don't mess with people's benefits. Because there are those income thresholds that if you go above, all of a sudden, like, sure, maybe you get like $1,000 cash from us every 6 months, but now you've lost your SNAP, you've lost like your food voucher, you've lost different things like that. And so being like hyper intentional about that and not like creating an unintended consequence is something that we're trying to be like extremely cognizant of. And I think it just helps that, one, we like come from the field. We've like a lot, and we have advisors and teammates and friends who are both like have like lived in those circumstances, are living in those circumstances, and also who like help lead policy around this as well, so they can help us stay focused on it.
So why did you pick Las Vegas as the pilot? I mean, one would hope that you'll go totally counter to the theme, what happens in Vegas stays in Vegas. In this case, we want it to...
That's so funny. Totally. So Vegas was really intentional as well. And it's not just because I like the desert and nature and the people there, although those are great reasons as well, especially because I'm planning to move out there next month to help launch the pilot. But so before we go nationally, we're going to run the pilot in Las Vegas, and we could do it anywhere in Nevada, but Vegas is really like where we see the most the most cases. But we chose it because, one, it's in bounds, like from the regulation perspective that we were talking about, and then, or it seems to be, and then two is it's one of the CDC's EHE jurisdictions, which is a list.
Ending the HIV epidemic, right?
Yeah, exactly.
Which, of course, was one of the gold standard programs launched in the Trump 1 administration.
Yeah, exactly. And it was like, frankly, it's just a great program. You know, it's funny. Like, I know a lot of people feel a lot of different ways about President Trump, but he did the HIV community in that way. Like, the community is grateful because it put a lot of money, like I think $587 million more dollars for like HIV care and treatment into the community. And you know, it's a mixed relationship with him for a lot of us. But at least on that, like him moonshotting ending the HIV epidemic was good. You know, I don't care about anyone's politics. That's like, that's a good thing to do. That's a pro-human thing to do, rather. And so anyways, but as part of that program, the way that they rolled it out is they identified the CDC identified 57 jurisdictions, which were states and cities that overall accounted for 50% of the new HIV cases every year. And those places were called EHE jurisdictions. And Las Vegas is one of those. And so that's why it was on our short list of potential pilot locations.
Now, when you think about Shine, do you think of it as technology-based or a method to implement rewards, incentives rooted in data that proves the effectiveness of such investments in individuals who adhere to treatment? How do you balance, in your mind's eye, is this a tech startup, or is this a program implementation company?
Yeah, it's a great question, and I don't parse it out so much. I mostly like to say I'm a simple guy. I make companies out of tents. I really just think of it as building a tool to help the world. And so like the medium that we're using is technology. But it's like, but the whole point, we're just using technology to meet the goal of increasing like undetectability across the country. And so it is funny because like one of like the cool things that I've got to learn is like every once in a while I like kind of like, I was gonna say black into this moment, but I don't know if that's an appropriate phrase, but I realize like, oh my, like, or I remember like, oh, that's right, we are running a tech company, you know, because we have a founding software engineer who's telling me about all these things, We had a deep conversation about AWS servers yesterday, and like we're looking a lot into HIPAA compliance, which I'm sure we'll talk about. But yeah, I mean, I guess we are running a tech company, but really like the point is to to wrap the world in a blanket of love and just like help people get as healthy as possible. And also if we can put some money into people's pockets to make them less stressed and just feel better generally and overall, it feels like a really good thing to do. So we're pursuing it.
You threw in Shine's mission statement there, wrapping the world in love. I rather like that. What was the thinking behind choosing that? It's not a very tech bro like mission, is it?
No, but I mean, we're not tech bros either. So, and I could just show you Marianne, our founding software engineer, and she'd be like, "What?" No, wrapping the world in a blanket of love. I don't know. It hit me like years ago. I mean, we've been focused on this since 2019. And in the field since 5 years before then. And we would have launched it sooner, but COVID came along and we ended up doing through 110 Health nonprofit, we ended up doing all of DC's COVID testing on Sundays. And so that distracted us and me for a little bit, but it also felt appropriate. But wrapping the world in a blanket of love, it just feels how I feel. And like, you got to be careful with it. You don't want to seem paternalistic or feel like like what's best for people and things like that. But I think just being really gentle, cognizant, and intentional and genuine in our desire to just help people is how we operate. And wrapping the world in a blanket of love. Honestly, I thought about my mom and like just how I feel like being so loved by her. And I think it like came from that feeling and just wanting to like, I don't know, do everyone a solid. Because what could be better? Like, you get healthy, you feel empowered, like you take your medication, you see this like viral load that's going down. And then you're one of the primary stresses of people's lives, like finances, like gets alleviated to some extent, like immediately. And like, oh, by the way, like now you can worry less about accidentally infecting your partner. Maybe have sex without a condom, but so long as you're like undetectable, like you can make these decisions. You can make these healthy, good, awesome decisions. So wrapping the world blanket of love. We go back and forth because some people like think it's a little too mushy. So we'll see like how long it's up there. But no matter what, like it's always how I'll feel, and it's just what we want to do.
Well, I find it really interesting because it is an expression of compassion in technology that can sometimes be quite private, individual, and almost lacking in humanity. So I think it's very interesting. You mentioned HIPAA, and for those who aren't aware, that's part of the US legislation that protects patient privacy. And clearly, the application of technology, uploading your information, your HIV status, your viral load status, that can come with great risks. Yeah. And how are you going the extra mile to protect people who use the app to make sure that they can feel as reassured as possible that their data is safe, that it won't be hacked, or that vis-a-vis what happened with 23andMe, not that that's going to happen with Shine, of course, but that the data might be sold on or the data might be utilized by others. How do you protect and reassure patients?
Yeah, it's a great question. It's super, super important, especially around something like HIV where there's so much stigma around it anyways, and a lot of undue shame is how I feel. But it's just part of how people feel, and it goes with the history of the virus and a lot of things. As far as so the way we protect the data, HIPAA compliance is huge in the US. And it's something that our founding software, I'm giving her so many shout outs, Marianne is totally on top of. And I'll talk about my co-founder, Dr. David Schaefer, at some point, but he's amazing too. So what we do is we make sure that all the data is encrypted. I think we're using 256-bit encryption, but then also digging into both the HIPAA compliance regulations ourselves, but then also having a HIPAA compliance audit. A lot of it really comes down to, once you have that encryption, those walls around the data, it's having strong policies to say who can see what data plan. That's really what a lot of it comes down to. And so we're developing those, making sure they're super tight. making sure that we have a HIPAA audit before we launch the app, are all things that we're doing that are like legally required. But the things that I think about a lot, because a lot beyond that, are the things that like are the realities of life and how we can protect people's HIV status beyond just what's legally required. And so different things that we're thinking about are like, while we're focused on HIV at first, and long run we might go, and it turns out like almost every chronic condition has low adherence. And so we might get to apply Shine to other diseases and chronic conditions in time. But while we're just HIV, one of the things I think about is I just like jump into the shoes of the user, if you will, the person who's downloaded the app, and different things like our notification cadence, and our app like icon. If Shine is understood as the HIV app, if you will, then even like seeing that you have it downloaded can be like incriminating, if you will. And so being like trying to be really smart about like, all right, nice. Well, if that's the case, then how do we solve it? And like one way might be like just allow people to choose from a bunch of different icons within the app. So nobody sees like I'd love for everyone to recognize our logo in the long run, but like, so nobody sees our logo there because people have like selected away from it. Allowing people, we'll see if we can do this, but like allowing people to rename the app, different things like that. And then being really careful with our notifications and not saying like, when we confirm someone's viral load and we're going to send them money, like not saying like, hey, congratulate on their push notifications. Hey, congratulations. Like your HIV is undetectable or whatever, And we're designing a lot of that messaging, but like that's the way that I think about privacy beyond just like making sure that it's tight, like the castle is sturdy for people, but like just caring about how they feel and caring that they want to keep it private if they do.
I love that. I hadn't thought about it, but a message popping up on your cell phone when you're in a team meeting, or if you're in a bar with friends and like, hey, your viral load is undetectable. Yeah. But then presumably this is something as you expand into other therapy areas where that perhaps becomes less of an issue.
Yeah.
I mean, looking at the approach that you're taking, I immediately see relevance for the management of hepatitis B and C, for example.
Yeah, exactly.
But you are right that this could also be around getting your bloods for diabetes or for high blood pressure. And so what's the long-term strategy there? Are you thinking about that, or are you still very much centered at this stage on HIV?
Yeah, it's a great question. And it's one of those things that like you balance between making strong plans for the future and then understanding that like everything's going to change with time, So we're dead set focused on HIV ART right now. I could see PrEP being a really natural next step for us. But starting with ARTs, I think better because like adherence for it is non-controversial. If you have HIV, then you should be taking your meds. Whereas like PrEP, maybe somebody might be incentivized to self-report like different risk factors that aren't actually true, so they can like get the money and take PrEP. Different things like that like we'll deal with when we get there. And there are ways that I think we can solve it. But like, so really like locked in on HIV ART right now. The way I think about it is we really want to, from like an expansion perspective, I'm really thinking mostly right now over the next few years of one, having a great pilot, getting great data, and then expanding both geographically as well as like getting the people who are on CMS insurance involved, because it wasn't just lip service earlier when I mentioned it. Like that's really seriously part of our plan, because if there are like a handful of well off people and like one lower income person, like that's the person I want to help, the lower income. And so,
well, that's right. The incentives really work for those for whom that $1,000 every 6 months is really, really meaningful.
Totally.
I can see a value in PrEP, given that there is such an focus on getting to zero and reducing infections to an absolute minimum. And I can see that there's value in a reminder that stock up on your ARVs, or if you're having the long-term injectable, it's that time of the second half of the year to go and get your injection.
Yeah, exactly.
Interesting challenge, though, when it comes perhaps to, at that same point, you get an HIV test to make sure you are still negative. And that's obviously not something necessarily that people would want to hear about through a message coming through their cell phone. Mm-hmm. But I think it's interesting nonetheless. I can really see the applicability there.
Yeah, totally. And in the long run, that's a great point. Like, we could incentivize, and this is the beautiful thing about behavioral economics, like, it's just a tool to help incentivize positive outcomes. And like, people really like take care of themselves, and like empowerment, and like getting like good health outcomes. And there are cool network effects in an infectious disease too, because like if you help one person, like you indirectly help a lot of other people who like no longer need to worry about like accidental infection, different things like that. So we could incentivize testing in the long run too, even for people like without HIV, because like 13% of people with HIV don't know that they have it. And so there's big value in doing that testing as well. And then I just want to finish like answering your last question about like the plan and things like that. Like, sure, the plan is to expand like geographically as well as to different groups of people. But like that is all in pursuit of the mission of ending the HIV epidemic. And so that's why we do it. Like, period. Like, we need to go to like every corner, nook and cranny, and like get Shine to people who can benefit from it, because my goal and our goal is to end the HIV epidemic. And I think it'd be a beautiful thing to do, and I'm pursuing it very, very seriously.
Well, Mackenzie, that is a great place to end up. Mm. Is there anything that we've missed? Is there anything else I haven't asked that you think is important that our viewers and listeners understand about Shine?
No big things. I really appreciate getting to talk about it with you for a while. I think the only thing that I would mention is that we're still relatively early in this journey. We're far down the road, but we're early in the journey. And so if there's anybody out there who's excited about Shine and what we're doing and wants to help us get the job done, I'd really welcome anyone to reach out to me, be it for partnership, investing. If you're a potential user of the app, I want to hear from you, and the bigger team, the better. So feel free to shoot me an email. My email is mackenzie@shineapp.co, no M. And then also on our website, we have a reach out button that we have our eye on. And I really want this to be a thing that is for the community and of the community. And so the bigger team that we have and the more people we have with us, the better.
So if you are living in Las Vegas, how do you get in contact with Shine?
Yeah.
Who are the NGO community partners, public health partners? If you're living with HIV in Las Vegas, you're on treatment, you think this might be interesting for you, how would you go about contacting Shine?
Yeah. So there's the pilot stage, and then there's afterwards. And so at the pilot stage, we've partnered with 5 or 6 of the top clinics out there who have access to, I think, 2,000 patients overall. And we're going to start the pilot. We're going to run it with just between about 20 and 250 people or so. And I think we'll probably select quite randomly just to get as good data, as publishable data as possible. And so I don't think there's like much to do to like get on Shine right now, but people can come and join our wait list on our website. And then after the pilot, which could be anywhere between say like 3 and 12 months after we begin, as designed, people won't need to come to us. We'll go to them. All the providers, the nurses, the doctors will let their patients know about this. And so it should become like very, very accessible.
Now, you did a very good job giving out your email address for folks to contact you, but you didn't tell us what your website is. We'll include it in the show notes. But to give a shout out to it now, do you want to just tell us what it is?
I appreciate it. It's the suffix of my email, and it's shineapp.co. Wanted shine.com, but it wasn't available. So that's okay. Maybe in the future, but for now, it's shineapp.co.
Oh, well, it's really interesting because I think the future is moving away from the .coms into various other domain names. And I know my partner in crime, our producer and director, Eric Espera, thinks very differently to me on that. So I'm holding out for shine.co. Huh?
I appreciate it. Yeah. The domains are the wild, wild west. And it's fun to get creative with the different combinations.
Yeah. Well, look, Mackenzie, stay in touch with us. Let us know how it's going. I've really appreciated your enthusiasm and vigor and excitement about what is possible. I think us older dinosaurs in the HIV movement are feeling a bit tired and in need of a shot in the arm ourselves. And I think you've really provided it to us this morning. So thank you very much.
Oh, I appreciate it. And so many of the people who have been in the field for years and since the beginning are great friends and advisors. And as they always say, like, you know, we're standing on the shoulders of giants. And so appreciate all of the work that you and different people have done. And takes a big team, and really appreciate you having me on today, Ben. Thank you.
Thank you. Well, that's it for this episode. Thank you to Mackenzie Copley. Thanks also to our director and producer, Eric Espera of A Shot in the Arm Media. And finally, a big thanks to you. You can find us on all your favorite podcast platforms, and please check us out on our YouTube channel. And finally, it just remains for me to wish you a safe week and a great week, everyone.